Hello, everyone. Thank you so much for joining us today for our discussion of queer identity, gender, and trauma. My name's Miranda. I use they, them pronouns, and I'm the Women's Program Officer here at the New Haven Pride Center.
Hi, everybody. Thanks again for joining us. I'm the Trans, Intersex, and Non-Binary Program Officer at the Pride Center, and I'm so excited to be part of this conversation.
Absolutely. And before we begin today's program, we'd like to take a moment to acknowledge the land on which we are hosting this program. The New Haven Pride Center was founded and operates on the traditional lands of the Mohegan, Mashantucket Pequot, Eastern Pequot, Schaghticoke, Golden Hill Paugussett, Niantic, and the Quinnipiac people. We hope that from wherever you are, you take a moment to acknowledge and honor the Native people whose lands you occupy and the history of the place you're in. Find out more info about Native lands at native-land.ca.
So today, we will be discussing how gender and queer identity play a role in how we experience violence and trauma. This talk is so important right now, especially as the queer and trans community have been gaining more and more visibility exponentially, but not nearly gaining the same amount of resources at the same rate, which leaves many in our community in really dangerous situations. The intersection of violence and gender is a complex issue, as one's gender identity greatly impacts their experience of traumatic events. Domestic violence, suicide, racial violence are all traumatic events that we experience differently given our gender or sexual identity. Throughout 2021, we at the Pride Center look forward to bringing you dynamic programs like this one. And if you want to learn more about our upcoming events, hit us up at newhavenpridecenter.org.
Finally, before we begin, we'd also like to thank our sponsors who made today's program possible. We'd like to thank CT Humanities for sponsoring this event, and we'd also like to give a huge shout out to the Connecticut Women's Consortium and Trans Lifeline for helping organize and facilitate this event. I would also like to take a moment to thank Nicholas Dion and our amazing ASL interpreters for coordinating the ASL interpretation today. If you'd like to know more about sponsoring programs like these, please reach out to us through info@newhavenpridecenter.org.
We'd also like to remind everyone that you are not alone, which is a hard thing to fully grasp sometimes. If you're struggling with trauma and you need help, if you have violence in your life, if you just need someone to talk to, there are various and numerous resources out there. Trans community members can contact Trans Lifeline specifically 24/7. The info is on the screen right now. And also, if you just Google Trans Lifeline, you'll be able to find the same information. You can also reach out to us on our warm line or contact our Director of Case Management, Juan Carlos Soto, for more help and resources. His info also was just on the screen.
As a survivor myself, I think this message is incredibly important, and I'd really like to, thank Elliot and our panelists today for having this amazing conversation, and thank all of the amazing people who are doing this work to provide these resources to the queer community. We'd now like to share a few words from Kathleen Callahan from the Women's Consortium. Using advocacy, training, and education tools, the Connecticut Women's Consortium strives towards a behavioral health system which responds to the needs of women, LGBTQ+ individuals, and people of color, as well as the people and organizations that affect them. With emphasis on holistic, trauma-informed, gender-responsive care, the consortium works collaboratively with nonprofits, state departments, and direct service providers to promote environments that are safe, trustworthy, collaborative, and empowering. As an organization, we recognize and adopt wholeheartedly the belief that effective treatment and organizations respond to the differing contextual needs of people of all genders. Moving forward, we will continue to fight for an equitable behavioral health system through both our trainings and our advocacy, and expand our work toward inclusivity and equity. And they look forward to listening and learning this evening, as we all do at the New Haven Pride Center. Thank you so much. And now it is my pleasure to introduce Karleigh Webb, the amazing journalist, activist, and moderator for this event.
Thank you, Miranda. And again, a special shout out to Tristan and Simone, our ASL interpreters tonight. It's great having you both along for the ride. And I promise that this particular discussion will have those hands moving because there's a lot to talk about. The Oxford Dictionary defines the word trauma as, quote, a deeply distressing or disturbing experience. And as we find, as we go through this life within the Rainbow family, there are many of those experiences as we come into ourselves. And those experiences are in some ways used to silence us. But in Resistance, we are reminded by writer and womanist Alice Walker that no person is your friend who demands your silence or denies your right to grow. And part of that growth process involves the pain of not only meeting trauma head on, but also dealing with it and understanding it. And that's what we're here to discuss tonight. Tonight, we have with us 4 panelists who are experts in dealing with those traumas and helping people through those. And each in their own way have perhaps gone through this journey themselves. I know that this reporter has. The 4 panelists, Brielle Roundtree, Nadine Ruff, Shane Scott, and Ivy Staklo, have worked closely within our community and as people of our community and have helped many people through within our community. And tonight we're going to have what I hope will be a very enlightening and educational discussion. But we will begin by introducing our panelists. And in fact, I'm going to let them introduce themselves. And we will begin with Ivy Staklo.
Hey everyone, I'm Ivy Staklo. Nice to see everybody here. I use he, him, or they, them pronouns. I live here in New Haven, Connecticut, have for a while, and I work as the Hotline program director at Trans Lifeline, which you'll probably be hearing a little bit about during this panel overall. But just to give a little bit of intro, Trans Lifeline is a fully trans-led US-wide nonprofit. We have 2 direct service programs. We pay for people's ID changes and also do advocacy for trans people behind bars. And the program that I run is a hotline with a US number and a Canada number. We have volunteers and staff all over the US and Canada. And everybody who answers the phone on our peer support hotline is trans. So we're by and for the trans community, fully anonymous, fully confidential, and we do a lot of trauma-informed work. So I'm really excited to have this conversation here with the rest of these amazing panelists. And always thanks to the New Haven Pride Center for hosting this.
It's good having Ivy with us. And full disclosure, I work with Ivy at Trans Lifeline. Coming up next panelist, Shane Scott. Shane?
Hi, hello everyone. My name is Shane Scott. I use he, him pronouns. I am a licensed clinical social worker. I've been practicing for going on 9 years, which is crazy when I think about it. I have a private practice, and I also collaborate with a lot of agencies and corporations in Connecticut to provide training, development, and just really understanding how to work with the queer community and understanding gender and sexuality. Most of my clients, about 90% of my clients, are identified within the LGBT and queer and trans community. And I feel really blessed to do the work. And I'm also super happy to be here because I see the impact that trauma and identity have on folks every day. And I feel really honored to help people the folks in our community and to be a part of that, because I think it's hard. It's a hard journey. And so I'm super happy to be here and just share my experiences so thank you.
Great to have you aboard, Shane. Next up is another colleague of mine from Trans Lifeline, Brielle Roundtree. Brielle.
Hi, my name is Brielle Roundtree. My pronouns are she, her, and I am the Domestic and Intimate Partner Violence Coordinator at Trans Lifeline.
Brielle, looking forward to talking to you tonight. And finally, someone who has been a mentor to many of us in our local community here in New Haven and throughout our state, Nadine Ruff.
Hi, Hi, everyone. I didn't see me for a minute. I'm Nadine Ruff, MSW, master's degree in social work. I've been doing this work for over maybe 10 or 12 years, helping the queer and the transgender community. Is And I've come to realize that we do have a lot of trauma. So, like, it's my job to and my goal to help all of us to, like, come through all of that. I'm a founder of Divinely You, which has been around for a few years. It's a trans support group. I also am a program coordinator at APNH for people living with 50 and over living with HIV. So I try to do my best to help this community any way that I can, and it's good to know that people are watching what we do to make a difference in our communities. And I'm grateful to be here with you guys.
And it's an honor for me to sit around the campfire with all of you tonight. I have a feeling I'm going to be doing a lot of learning from this chair. And just a note for everyone who's watching this and taking in this special program tonight, if you have access to our chats, Facebook Live, YouTube, please, if you have a question to ask, want to share a thought, you can comment from where you are. And if you have a question to ask, I'll make sure that question gets asked to our panel and they get a chance to answer. But me being the moderator, I'm going to take moderator's privilege, and the first question will be mine. And I'll fully disclose to begin with, it was recently in the last year that I was able to open up and really come to grips with the trauma that I've experienced throughout life, throughout transition, throughout learning who I am. And along the way in that process, I realized that I really didn't understand all that trauma entails. In your work, in helping people, and perhaps even in your own lives, what do you feel that others or yourself misunderstood about the trauma that we go through within our queer communities?
Are you asking any particular person?
Yes, anybody can jump in on this.
Okay, well, I'll start. Not only do I try to help people get through trauma, being a woman with a Black woman with a transgender experience, we go through a lot of trauma in our community, and a lot of times we don't realize that it's traumatizing until after we have gone through it, and a lot of us live our life with this trauma, not realizing that it affects us in any manner. And so, like, for me, I recognize the trauma because most of it I've been through myself. And so when I see a person that's going through trauma, I try to kind of get them to address it, as I kind of like pull it out a little at a time, so that they may feel comfortable in addressing the trauma that they have been through. But a lot of times I recognize this trauma because, like I said, I've been through it. Like a lot of things that I've been through, I try to prevent our young trans individuals from going through that same issue, if I can. So I think a lot of us don't really recognize the trauma that we go through until we're through it, or if you understand what I'm trying to say. We don't recognize it until it has passed, and then it plays a part on our lives and also on our bodies as well.
Shane, what do you think?
So yeah, I think one of the first thing that came to mind is that there's a lot of misperception and a lot of misunderstanding about trauma. And I think in a general context, trauma is often perceived as like being related to war or very severe things that happen to people. So I think oftentimes when we're talking about sexuality and gender, it's often misperceived. And it's not seen as like, well, it's not seen as trauma if it's from relationships and if it's from coming out and it's from multiple things. And so trauma is very personal, and it affects every single person differently. And it also mimics a lot of other conditions and symptoms from a clinical perspective. So it's oftentimes misdiagnosed and not seen. And as Nadine stated, that we don't really realize that we were in traumatic experiences, especially if there's multiple things that occur, if there's multiple events, if there's multiple things in our lives that most of us have probably been through. It's like, oh, well, that's just something I go through, right? And we don't think about it. And then it's sort of like this detachment that comes. And so it's really important to acknowledge for people whatever they feel is traumatic, and whatever that person, whoever they are in your lives, it's important to acknowledge that if they say they're struggling with something, if they say they've been through something that's traumatic, even if it doesn't seem like it, it's traumatic to that person. So it's super important to acknowledge that it's so complicated, and it's not just related to military experience or major things happening. It's sometimes the little things that really impact our ability to trust and to live our lives fully.
Brielle, how do you see this, especially in the context of the work you're going to be doing? You're working directly with one of the lead sources of a lot of trauma, relationship trauma, domestic violence. What is it about trauma, especially in relation to those issues, that you think a lot of people misunderstand?
Some of the things I've misunderstood about trauma is just we process and internalize trauma differently. So there's no right or wrong approach to trauma. Everyone handles each situation depending on circumstance, environment. All of those things factor into how you internalize and process trauma. It's one of those things where I've begun to understand that it's a self-guided experience when processing for healing, right? Everyone doesn't heal the same. Everyone doesn't deal the same. And those are things I like to keep into perspective.
Now, Ivy, now I don't want to touch on that. There's something else, because you've spoken about this at length. Not only are there things we misunderstand, but oftentimes, especially with trans people, we tend to deny our trauma, or try to say, no, it really didn't happen, or no, it wasn't that bad, or no, I don't want to be a burden on people, so I don't want my trauma out there. Why do you feel people have a tendency to like me, for example, try to deny that trauma?
Well, I mean, I think that I don't think that that's unique to trans people. I think that we live in a society that constantly tells all of us, but obviously especially the most marginalized of us, that we deserve to suffer, that we don't deserve access to our basic needs, right? You know, when you live in a society where you're constantly told that if you don't have food on the table, if you don't have a warm place to sleep, right? If you're experiencing an unsafe environment, something about that is your fault. And you hear that from a very young age, which is something that's omnipresent in US society, right? You're going to carry that with you throughout your whole life, right? You're going to think that you did something wrong to deserve what happened to you. And a lot of the time, because that is the systemic trauma that all of us grow up in, if we live here and all of us kind of percolate in all the time living here, it's very, very hard because of that to discern when things are happening to you that you don't deserve, right? Adding to that, right on top of that, societal systemic transphobia, where we're told that we don't deserve to even be our authentic selves, and that by being that, we are a burden on other people. Combine those two things together, and add to that the lack of adequate resources and the lack of trauma-informed and trans-informed support. The easiest default for people to go to is just to blame ourselves for anything that happens to us. So a lot of the time we don't even identify things as traumatic or as unjust or as damaging or as undeserved. And it takes a lot of work. And I think for a lot of us, especially in the trans community, it takes a lot of exposure to other people who are in our community, who have had these same lived experiences, and to have somebody be an honest mirror to us and say, no, you did not deserve that. That's not normal. None of this is normal. And as we kind of grow these conversations about normalizing the trans experience, about centering trans experiences and uplifting trans experiences as a part of this society, as a part of human survival in this society, we're going to learn more and more and more and more that so many of the things that we experience are unjust and therefore traumatize us. And yeah, I really appreciate what the person is saying in the chat, that we don't have the privilege to process our trauma in the way that other people do. When you have access to work on that, when you have access to think about that, you know, you're going to be able to process things a lot better. So we need to create spaces like this discussion, like spaces in our own communities where we can be honest and vulnerable with what we've gone through. And I'm really excited to hear more from this panel about how we do that in all of our work.
May I piggyback on?
I was about to call on you for that, because I mean what Jace Roach was talking about just a second ago, I mean, that's the crux of it right there. In fact, Patrick, if you can put that back up.
Yeah,
I think everybody needs to see that and hold that up for a second. We just don't have the privilege to process our trauma. Nadine, what were you going to say about that?
Well, I kind of agree with, I was going to mention on that, because a lot of times we don't realize it is trauma, because like Ivy was saying, like when you're young and you're trans and people put it starts at home. When your family puts you out because of who you are, you all of a sudden you feel like maybe it's something, me being who I am is wrong. So now you go out into a society and they mimic what your family has told you. Then again, that's more trauma that you induce, and a lot of us feel like that we don't recognize that as trauma. A lot of us think that it's just a part of who we are because we're trans. And honest to say that it takes a lot of, when I come to realize being in this community, a lot of us have a lot of trauma, and a lot of us are mentally hurt with that trauma, and it affects our lives on a regular. And when I sit back and look and sometimes I ask myself, well, why hasn't it happened to me? Well, it has happened to me, but like you said, sometimes I deny that trauma because I feel like that I made it to the other side, so I'm here to help other people that follows behind me. But nevertheless, there's still trauma. And so like when I see it today, I recognize it. You know what I'm saying? I can recognize it from others because that I've been through it myself. And especially for people of color, there's a lot of trauma. There's a lot of trauma. You can't in our family lifestyle, in our history, because they don't believe that trans, they think is a sin, and so it calls us to believe that it's against the Bible and things like that. So a lot of us are homeless, and that's part of a trauma. There's so many different transitions of trauma that it's crazy. So I think we need to start to point out these traumas so that way we can stop denying them.
Shane, I want to touch on you here because you work directly with a lot of the byproducts of having to deal with this trauma, things such as substance abuse. How do you even begin to unravel the trauma piece when you're trying to work through all those other issues?
Well, so I think that in the comment that was on Facebook from the participant was really spot on, because I think you have to address the survival mode, right? And so you have to help identify what those needs are first. And so it's very difficult and almost impossible to help someone with trauma if they're homeless and worried about food and trying to get a job, or their family's not supportive. So I think you have to start with resources and getting them stable and figuring out what they need for support. And so that's really the first step, because there's so many risk factors and so many subsequent things that come out of this trauma, especially for trans folks. So it's very difficult to address that. And sometimes it's really helping normalize the trauma they experience, helping them get the resources they need. And then sometimes it's setting up referrals and getting them connected to support groups, especially young folks like teens. It's getting them connected. And then you can start to address that trauma. But for example, substance abuse, someone I mentioned earlier, is 70, it's I think 60 to 70% of people that are in the LGBT community have some experience with using substances. If it's not an issue, it's been a part of the experience that they've had. So oftentimes what happens is that if that's an issue, that has to be addressed first, right? Because if someone has a substance abuse problem, that has to be addressed and taken care of before we can get into the trauma, because the alcohol, for example, triggers a lot of mood swings, triggers depression. So there's a lot. So it absolutely is like, there's a lot of work and a lot of relationship building that needs to happen first in order to start to address trauma.
You said something very important just a few minutes ago. And in fact, all of you really touched on it, survival mode. Mm-hmm. And I find that term is very apropos given the day that this conversation is happening. As we're having this discussion, we have seen something that's been a source of trauma, so to speak, leave our lives, and that was the ending of the Trump administration. With that in mind, talking about survival mode, how much more of just raw survival mode have you been seeing in the people you work with and interact with over these last 4 years, and also in this last year, given what's been going on in the greater world around us during that time? Brielle, I'm going to start with you on that.
I know that I've seen a lot of trauma and a lot of substance use disorder, because I think it takes for most people that are trans to deal with society on a whole. A lot of us tend to want to navigate through society not being seen. So a lot of what I found and saw, and what I also happened to me, it was I used drugs so that I can numb all that type of stuff from society. And I find that it's a lot of trans individuals are using drugs to numb their feelings about what society thinks and what they have to go through on a daily basis. So what they're doing is numbing that trauma as well. So I think through the last 4 years, a lot of people are trying to find their way out, if you will, of that trauma or the substance use disorder, and don't know how. And that's when it comes to people like Shane and myself, who can guide them through that path of trying to find recovery from whatever substance use disorder they have.
Brielle, also, I want to touch with you on this, in part because you worked with younger people a great deal before you moved into the position you have at Trans Lifeline. What has that survival mode been from the perspective you've seen from younger people, especially in these recent times when it seems the community has been under an endless siege?
Well, what I've been able to discover is like my own experiences with survival mode while processing other people's experiences and seeing how similar that is. Like being a person that is providing help for someone, I'm not necessarily given the space to process my own stuff. You know what I mean? There are times where I didn't understand like where I would find money to pay the rent, or that I was being pay enough to make sure that I had food sometimes, but yet providing hope and space for someone else to process. So survival mode is real. It's something that I'm still locked into, is my own trauma that I'm dealing with on an everyday basis. And I constantly challenge myself to acknowledge that is exactly what I'm experiencing. I can tell you, even now, having a job where I'm working for and by trans people feels beautiful to me, because I've never been like welcome and affirmed in the ways that I have been, but also just this imposter syndrome of feeling like, when is this going to end? Because I don't deserve to be here. Like, what did I do to deserve to be here? I'm still learning myself on how to unravel the moment of survival, or the time or survival. Like, I'm stuck in that. And it's something that I'm figuring out on an everyday basis. So I really don't have an answer as to how we could assist folks with navigating that. I know some of the things that I do is just to remind myself or affirm myself that I am worthy, that I am deserving, and I try to do that on a constant basis. And I try to also challenge other people to affirm themselves and others that they come in contact with who are experiencing those same things. But yeah, survival mode. I'm trying to shake it, Karleigh. Trying to shake it.
I think we all are.
I would second that. Ivy, in the work you've seen at Trans Lifeline, and also doing that work, and after all, you trained me in this to begin with. We see call to call, we hear this often. In a sense, give the people out there who may be watching this an idea of how difficult it is to especially get past that imposter syndrome, and in a sense, also where do you even start to try and find that self-worth? Where does that revolutionary act that a Janet Mock talks about of just wanting of being who you are and loving it and being present in your, where do we even start to foment that and combat against the survival mode, the imposter syndrome? Where do we even start?
Oh, that's a good question. This answer is gonna sound like a cop out, but it really truly varies from person to person, right? And I think that, I keep talking about how valuable trans community is, right? And so I mentioned in my earlier answer that trans community can be a mirror for you in understanding that you don't deserve bad things. Trans community can also be a mirror for you in understanding that you deserve good things, right? I constantly, in my work and in my personal life, and I see other people doing this too. When you're stuck inside your own head, it can be very, very easy to kind of give in to like that little voice that questions whether or not you deserve good things. And it comes from the same place structurally and culturally as the little voice that says you deserve bad things. Which logically doesn't make a lot of sense, right? Because like those two things should be congruent, but they're not, right? We're just told that we don't deserve good things and we do deserve bad things that happen to us. And so for me, when I have community members who affirm that, things that I've accomplished are having a positive impact, that, things that I'm doing to take care of myself are deserved, that like, I've done good work and I deserve to take care of myself too. It makes a big difference. Something that I saw that was really, it doesn't really work for me, but a lot of people really like it. I don't know if y'all have ever seen this meme that's gone around, where somebody said basically, if you're experiencing imposter syndrome, then imagine yourself as like a secret spy who made it past whatever the barriers are and tricked people into thinking that you're doing a good job. And you're like, hell yeah, I succeeded in being a super secret spy, right? And sometimes people amp themselves up that way. But I think for me, honestly, again, having my community be an honest mirror to me, in the not just the impact that I have, but in my partner says a lot that each person is an end unto themselves, that you deserve good things just by existing. You don't have to do things to deserve good things. And I think having connection like this, having connection with one another and reminding each other of that and retaining that connection despite, it doesn't matter who's in the White House. It doesn't matter who is, around you during COVID. It doesn't matter who's trying to let you down. If you have people that you relate to and if you have people that you share lived experiences with, it's a lot easier to ground yourself in that honest truth that you do deserve good things and you don't deserve bad things. And to the earlier question about like the Trump administration, has definitely been difficult for a lot of people because there's been a lot of flagrant, exposure of how much people hate marginalized people and a lot of empowerment given to those individuals. But also at the same time, something that I've seen in the past 4 years has been enormous amounts of empowerment for our communities to fight back together and to support each other. And in the face of flagrant hate, to really band together to show each other love and to show each other empowerment and to build a fight back movement. And I think for me, that's been something that's been very empowering. And it's going to be important for me to see that same love and that same empowerment and that same fight back movement continue regardless of who's in any office, because change comes from us, change comes from people in the streets, change comes from people supporting one another.
Got a comment from Jace again. I think the answer is here through discussion, dialogue, and building community with other trans folks. For me, even now, it's inspiring to see 3 Black trans femme in leadership roles using their experiences to pull others up in our communities. We're doing what we can, but also we know, Jace, you're out there doing what you can. So I thank you for that. Rapid fire with that in mind, because talking about congregating within our own queer community. Shane, I'm going to start with you, but you're all going to answer this. Name something that we as queer folks are doing within our communities to ourselves that's causing trauma and we need to stop. Go.
I think discrimination among our own community and not understanding and not trying to understand each other more. There's some division there for sure.
Bree, how about you? Brielle, you're muted.
I believe we minimize ourselves, right? We dim our own lights. We don't shine just because we are afraid of the success or afraid of having that good thing given to us, as Ivy stated.
Rocking it anti-clockwise. Nadine, go.
I feel that a lot of us, I think that people in our community need to be more inclusive with trans people. I think that we're not inclusive enough. I think there's a lot of separation between trans and gay men and things like that. And I think that it's hurting us because as a community, we are a whole, you know? So I think that's one of the things that really hurts.
Ivy, how about you?
I think I'll echo what everybody said. And I think that, that same system that makes us think that we deserve bad things also encourages us to turn on one another and to practice this really toxic individualism and to think like, oh, we're each other's oppressors. We're here, we're here fighting against each other, but we're really not. Like, we really need to be fighting together because we have common interests and we need to be there for each other. And that's something that I always remind myself of, is like, how can we connect better with other folks in our community and not allow that divide and conquer tactic of that system to keep trying to beat us down?
With that in mind, how do we who are doing direct service work and doing clinical work, how do we push against these systemic barriers? What do we need to do as people who are in the foxhole and in the fight? What do we need to do better? Or perhaps what should we be rethinking, or what are we doing to push against those walls?
I think there's two things. I think that education is super important, even among our own community, among the LGBT community. Education, advocacy is super important. And then also like being really self-aware and looking at our own biases and our own judgments, and really being willing to be vulnerable with that and be like, okay, I know that sometimes I can be judgmental and I don't know enough about this community, or I don't know enough about this, or this makes me uncomfortable, and being willing to explore that. Because I think it starts with us. Like, we have to be able to really be aware of like what's holding us back and what our judgments are, and be able to be willing to change that.
If anybody else wants to ring in, it's a free-for-all at this point.
Yeah, I just think challenging our own implicit biases. We do this thing that we like to call here the oppression Olympics, where we decide that our struggle is more important than the next person's struggle. So just seeing the humanity in folks and really giving them the opportunity to process trauma and provide compassion for people. Whatever happened to compassion?
And I also agree. I agree with that. And I also think that we need to, when dealing with people, we got to put our biases to the side, and we need to practice a little bit more patience. I know, me being from an older generation and seeing different trans from transgender to non-bonding and all that. It's like I gotta learn how to put those type of things away for the upcoming people, because at the end of the day, I didn't want anyone to tell me who I was. So how can I or anyone else tell somebody who they are? So I think we need to have more patience and tolerance with people who are coming around who's trying to identify who they are.
Nadine, talk about that for a second. How were you able, because when it comes to age, I'm not that far behind you. How were you
I'm
able
only
to do that
25,
work?
buddy. I don't know what you're talking about.
No, but how were you able to work through that? How did you come to that point where you were able to work through that, come to grips with that, own that, and move forward?
For me, like I mentioned, like I've been through a lot of trauma, and most of my trauma had to deal with who I was, and I used to numb who I was. So what happened was I didn't accept who I was because I knew society wasn't going to accept me. So I kind of did what a lot of people are doing today is doing that self-harm by doing things to numb how you feel and don't care. But after a while, after I gave up substance use, I had to learn to have some acceptance of who I was, no matter what society thought of me. And I knew it had to be a better way for me to live. And so, like, what I've come to learn is having some self-acceptance. It's not about what you think, it's about what I think about me. And once I learned about it's okay to be me and be okay in my own skin, then I start to like myself a little. Then once I start to like myself a little, I became to love myself. And once I realized that sometimes in our journey, we don't step into who we truly are. And once you step into who you truly are, there's a natural glow that comes about you. And you don't care about what society thinks. What you care about is what you can do to make an impact on the generation that's coming behind you.
Anybody else with anything to add?
On the clinical question, I can throw in on that.
Go right ahead.
Yeah. I think that with any direct services, with any especially in the clinical field, something that's always lacking or something that's always at risk of being erased is people's agency. A lot of the time when people provide services around trauma or mental health or social services or anything like that, we're trained in these fields to consider people who are vulnerable and people who are not in a great place to somehow suddenly be irrational, to be incapable of making adequate decisions, to be incapable of deciding what kind of coping mechanisms work for them. And there's a lot of really, really unhealthy kind of power dynamics that are at play there. So something that we try to do at Trans Lifeline is really center the agency in whatever way people need of the people that we serve, and truly provide a judgment-free zone in terms of what works for you works for you. And I know that is always an uphill battle in clinical work specifically, with mandated reporting, with violation of people's consent around certain things in certain situations. And that's something that we at Trans Lifeline always try to work around and against, because it does re-traumatize our communities to have those experiences.
A follow-up to that, and I want to start with Ivy, but I want everyone to ring in. How much do, be it service providers, mental health professionals, even partners, allies, friends, family, how much do we misunderstand and sometimes completely miss it on that word, agency?
Do you want a number? How much?
No, just in general, how much do we miss it, and why do you think we miss it?
I think we miss it because we're misinformed. I think that there's, again, I'm going to keep going back to the systemic and cultural thing. This is going to be my theme of the night. But if you're in a society that teaches you that it's normal to wake up hungry, that you deserve that it's normal to live in a society that doesn't acknowledge who you are, that doesn't guarantee you basic rights, and when you have an adverse trauma crisis reaction to that, you're going to be told that reaction is irrational. And so our entire mental health system, all of our direct service systems tend to be built around this idea that a crisis or a trauma response to a society that's unjust is an irrational response, and you need to be treated as a person without agency. You need to be treated as a person who can't make their own decisions, and as somebody that somebody else needs to make decisions for, medicate, institutionalize, like force into some type of program or whatever, judge your coping mechanisms, when the reality is our coping mechanisms and our trauma responses are perfectly rational and perfectly natural in the system that's transphobic and that strips people of basic rights and access to basic resources. And that's something that we always need to acknowledge. I think that if people understand that foundational truth, that trauma happens under the system and that trauma happens when people are denied dignity, then we're going to start seeing a much more fair approach to supporting people through their trauma and understanding what people need to do to survive, and understanding even the rationality for people behind feeling suicidal, and being able to speak to that bravely and honestly and without judgment and without condescension. And for me, agency is foundationally premised on having that understanding of systemic trauma. I think once we have that, we're going to get to a much better place.
Shane, looks like you want to step in there. Yeah.
Yeah. Yeah, definitely. I just want to add that that there's a lack historically and presently, there's a lack of humanity in healthcare. And so we still operate from a medical model of care, right? So that means that there's something wrong with you if you're not functioning in the system. But like Ivy said, the system is very broken, very set up for failure, right? So it's difficult, and as a provider myself, it's very difficult to find the balance between utilizing the healthcare systems in place, right? So getting patients, the clients, the care that they need, using their insurance because that's how they can get the care, but also trying to navigate that with like treating them like a human and giving them agency to do what they need to do and get the services they need. But also, sometimes it's giving a diagnosis in order to get treatment, right? So in Connecticut, to get top surgery, for example, you have to have letters of support and you have to have a diagnosis of gender dysphoria. But at the same time, like, you have to have your legal name and you have to use your legal name in the letters for the client to get the surgery. And so there's a lot of like inconsistencies and a lack of like acknowledging someone's identity, and it gets tricky. It gets very complicated and it's hard to like navigate that. But I think it's absolutely important to acknowledge that it's there, that the systems we have in place are indeed broken, and it's even harder to like find the humanity in that. So it's super important that we doing the frontline work acknowledge that and do what we can to navigate the system and help people navigate the system too, because I see it all the time with people coming in and have had horrendous experiences with therapists and doctors and teachers and all these places that they're supposed to feel safe, and people don't feel safe because of those experiences. So it causes so much trauma, so much resentment, and sometimes it's even hard for people to like go get treatment they need in order for them to survive and to thrive and to be successful in their lives.
Patrick, put that quote back, put that last comment back up there, because people need to read that. I want you to really let that sink in. The system was modeled by by cis heteronormative white supremacy.
Yeah.
Well, you better preach.
Yeah, I agree.
I actually want to follow, but quickly, before we go to that, I want to follow up with Shane on something really important based on what we just saw. That comment we just saw. As a person who works directly as a clinical social worker, how do you strike the balance between human and clinical? Because I can tell you from my own experience dealing with my own mental health, so often I've had so many therapists who get so concerned about what I call, quote unquote, the toys the toys like this therapy, this new DBT, what this, that, whatever, that they completely take the agency and the humanity out of it. In your work, how do you find, especially with queer folks, how do you strike that balance? How do you find that balance, and how do you self-correct when you may see it going out of balance?
Yeah, well, I'd say like there's 3 words that come to mind, like transparency, humility, and relationship, right? So I think it's really important to be transparent with clients in the community. So I'm transparent with them about who I am and that I'm cisgendered, and if I'm, you know, and I'm really honest and transparent about like my own privilege and even the perception of my privilege, right? So that's even people's experiences with people like me who are white, right? So I have to acknowledge that, and I have to acknowledge that, like, you know, what I can help with, but I also have to be transparent with, you know, when I have to use medical terms or medical diagnoses, or when I have to do things to get things met. Like if I, you know, for example, I always tell clients that are trans that when I'm doing your insurance billing and when I'm doing documentation, I have to submit everything under the legal name, even if it's the name that they don't use because of the laws in Connecticut. So I tell people that, like, that's the only time that I'll use, you know, your legal name and the name you were given at birth. And I also am very clear that, like, that if I make a mistake, I completely own it. And you know, if I use the wrong pronouns, if I misgender someone, it's super important. And if I use the wrong name, if I pronounce their name wrong, it's super important for me to say, like, I'm sorry, I messed up. That has nothing to do with you. You know, that was my mistake. I would try to, like, put in pronouns, my pronouns wherever I can. I ask people what pronouns they identify with, not which they prefer, but the pronouns they identify with. What are their pronouns? Right. So those are 3 things that I do. And just trying to be relational, trying to be as real as possible. And, you know, I avoid clinical words whenever I can, just because I need it to be real. And I think that's what works for clients.
Nadine, what do colleagues, clinicians, the people that we may work with and the people you may work with need to know, looking from the other side of that divide, coming as a person who is trans? What do allies, clinicians, etc., what do they need to know from the other side?
I think what they really need to know is, like, because I have some terrible experience before I got some letters behind my name in being trans, and I think they need to know how to have some care for trans individuals. You know what I'm saying? And because, like, I truly believe, like, they're starting to open up and they're starting to get a little educated, but they're still not as trans friendly as they need to be, because you can get stopped at the door by the receptionist. If she gives you the wrong impression and you're asking for some kind, maybe it could be for your hormones, whatever, or go and get a checkup. If the receptionist is not approachable, you're not going to be able to go see Shane. You're not going to see him because you never made it front desk. So my thing is, all these different organizations need to learn how to become more trans friendly, so that way that you can be able to adjust. That way you'll be able to affect the new upcoming generation of trans individuals.
Jayla Mendez said, Shane, well put. What was that?
Need to be some schooling or training.
Yeah.
In fact, that's what Jayla Mendez, who just had this comment, just said. A perfect opportunity for case to cause advocacy. Let's bring education to these spaces and holding administration accountable for creative safe spaces. Now, when we talk about education, because we all know and we've all had the frustration of dealing with places that have no clue.
Yeah.
I think everybody on this panel at one time or another has been brought in to be a guest speaker for organizations that have no clue. What's the first step that I'm going to rapid fire start with Brielle? What's the first step for people that have no clue to get a clue? What's the first step you'd give them? Brielle, you're mute again.
I think you just have to take the initiative in educating yourself. There are so many resources out here for you to educate yourself. You can click onto Facebook, YouTube. There are groups. There is research. I think for myself, this is an I statement because I can't say every trans person believes such, but also stop isolating our identities and experiences. We experience trauma the same way you do. When we show up and folks are disrespectful, we feel neglected or disrespected the same way you do. So stop isolating our experiences. Yeah, just educate yourself. Start there. And when other folks have questions, feel free to answer if you know where to point them in the right direction. Share your knowledge. It's out there.
I think it's knowing when to get supervision, when to seek out education, when to seek out trainings. And I think that there's a lot of, I know for a lot of, there's a lot of clinicians that want to be trans affirming and want to be queer affirming, but they just don't have the experience and they don't have the training. So it's important to, and there's a ton of trainings out there. Like I do trainings. I've done trainings through True Colors. I think New Haven Pride Center does training. So there's opportunity to get education. I think that's super important to have humility. And I think that's my theme for tonight, is having humility, right? About like, you don't know what you don't know. And it's important to be very conscious about that.
Well, I also believe folks have to move out of their own way. A lot of us just believe in our own ideologies and we don't even want to give folks the space to be who they are. You don't have to understand. That's the thing. If you grasp that concept that you don't have to understand, you just have to treat me like a human being and with dignity and respect, I feel like the world would be a better place. But for some reason, folks need to understand why you choose to be who you are or why you choose to express the way that you do.
Nadine, I know you've been looking to jump in on this.
Yes, like education is the key, and I know for me that I've been in a lot of situations where I had to educate willingly. Like I've been to prisons where I had to share from a woman with a transgender experience. Like, what do we need? And be honest with them and tell them to ask the questions that you don't feel comfortable in asking. You know what I'm saying? Because I feel like if you can ask me a question, me being a Black woman with a trans experience, the next person that comes in your realm, you will have a better understanding on how to address them. So I asked them to, like, I've done it in schools, I've done it in corrections, in other organizations. I go to them and I explain, here's your platform to ask anything that you need to know about a trans individual. Not everything, but some things that you need to know about a trans, because I'm not all of them. I'm only one. But ask the question and don't be shy, because the dumbest question is the one that's not asked. And that way you'll get a better understanding on how to deal with the upcoming trans individuals, because they're coming. And they're coming. And they're coming.
A thought that's been in my mind, because we haven't touched on this yet, and we've got about 8 minutes left. I want to at least touch on this, because I know, for example, in my own work with Trans Lifeline, I'm sure that we all have at one time or another, we've heard the person who said, look, I just don't want to be here anymore. How do we deal with it? How do we need to look at that question and that statement and the whole issue of suicide differently, if we do need to look at it differently? Ivy, I want to start with you on that.
Sure. I mean, I think this speaks to kind of the previous answer that I gave too. When people are suicidal, that's a natural and rational response to the circumstances that they're in, especially in our community, especially in the most marginalized amongst us, right? And I think a lot of the time, one of the most valuable things is to be able to talk about it freely without fear of somebody carting you off somewhere without fear of somebody suddenly changing how they talk to you. I know a lot of people in our community who deal with suicidality on a day-to-day basis and live with it, and it is a normal part of our existence because we live in a society that doesn't want us to be alive. That's the reality. It is normal to feel that way. It's normal to not want to be alive in a society that doesn't want you to be alive. And when we talk about that to each other in a real way, and when we talk about it to each other without fear and without stigma and without feeling like something needs to be done about it, because trans people are already powerful, trans people are already resilient. We already have 1,000,000+1 different ways that we've kept ourselves dragging our feet through this transphobic life. And if somebody's providing a service to us, the first thing that they need to acknowledge is our innate resiliency and the fact that we have that agency, we have that right to feel suicidal, we have that right to not want to be here because of how the world has treated us. But yet we're here and we've each done it in our own way. What that looks like for each individual person is really up to that individual person. But I think that the first step is connecting with each other, being able to talk about suicidality without treating it like it's an emergency, without treating it like it's some form of deviation from rational thought, and just really treating it like any other experience that a person can have. And that's a normal human experience. And I really hope that someday, when we talk about suicide on a broader scale and on the larger arenas, we start talking about it in that way. But I think, like I said, the system thrives off of hiding the fact that so many of us live with suicidality and so many of us experience trauma. But I think it's really up to us to expose that and to normalize it and to be able to talk to each other about it.
Anyone else want to step in on it? Nadine, I see you went off mute.
Did I? When it comes to someone saying that they don't want to be here any longer, it tells me that they're tired of going through what they're going through in the trans life. So what I try to do is I try to have them explore that a little more. You know what I'm saying? So that way we can come to some kind of understanding and try to make them see that their experience of being trans is worthy, you know, and also is needed for the next trans individual that's coming behind them. So I try to help to find out what makes them feel that way when we kind of pretty much could understand why, but I want to understand from their standpoint of view, and try to help them to see that their importance, they are so important to be who they are, and it's needed.
I just want to echo what Ivy and Nadine had said. I think that those responses are spot on, and it's super important to normalize and to stay calm and to not go into crisis mode yourself and just be there. And sometimes I think just listening and normalizing is the best thing you can do.
We're at about 5 minutes left in this. So what I want from each of you is a closing statement. And what I'm looking for is, in a sense, what is the one takeaway that you want viewers, that you want any clinicians to see this, anybody who's currently in the business of serving our community or looking to get into it, whether it be direct service, whether it be activism, whatever it is, what's the one takeaway that you want to see? And Brielle, I want to start with you. Unmute yourself this time.
Yes. I think I'm just going to use a quote by Arthur Ashe that I always refer to, that you will start where you are, use what you have, and do what you can. It's just that simple.
Ivy, how about you?
Well, I think that, I guess going back to the clinician thing, going back to anybody who does direct service, you know, we talked a lot about trainings and we talked a lot about how like people need to educate themselves and all that jazz. I think people need to recognize that they were miseducated in the first place. Our curricula as people who studied mental health are wildly wrong, wildly inaccurate, right? We are taught completely false information about people, about how gender works, about how bodies work. And when you're coming from that background, there's always more that you need to do. There's always more that you need to do to undo the harm that's being done to our community. One of the most empowering things that you can do for trans people is help trans people connect with other trans people. So there's always opportunity for that. I'll also say, like, while it's important to educate yourself, you should probably check in about like what resources you should and shouldn't be using. Cause like I would say, you know, if you're comfortable saying like, go Google it, then you're comfortable saying that somebody should get their information from the wrong source and get false information. So for me as a trans person, I always try to do work to get people the right information. But also just acknowledging that if you don't have that lived experience of being trans, the best thing you can do is help a trans person get community with other people who relate.
Shane, how about you?
I think, just practice self-awareness, deconstruct, like what Ivy said, like deconstruct things that are not accurate. Be open and inclusive as much as you can. And I think know what you know and be okay with that.
Nadine, how about you?
Well, for me, first, especially when it comes to trans people of color, I think that people need to be more welcoming to them, for one, and understand, if you don't know, how they're being killed like it's nobody's business on a daily basis, and work from there. Have some humanity, or treat them as if you want to be treated. You know, let them know not just Black Lives Matter, but trans lives matter as well. And so do your best to make them feel a part of our race, a part of being human.
I agree with Nadine on that 100%. I want to add one of my own before we throw it to Elliot and Miranda. It takes 1 second to do what I'm doing right now. Reach out. Just reach out. That's all it takes. Reach out. Reach out. I can tell you, I am here. I am here right now, sitting here doing this because Ivy Staklo reached out to me 4 years ago, and Nadine Ruff reached out to me 4 years ago. And now I'm sitting here. Why? Because they reached out. And that's why I encourage us all to do, even as we continue through all the crisis, even as we continue through the pandemic, even as we continue through the fights we will still need to fight. Reach out. And now I'm going to reach out to Elliot and Miranda, who are going to take us home. Shane, Brielle, Ivy, Nadine, thank you for being here tonight. And Tristan and Simone, thank you for brilliant ASL work tonight. Thank you.
Thank you so much, Karleigh. And to everyone, thank you all for joining us for today's program. I'm just in awe of the amazing work that all of you do. It was incredibly powerful hearing you talk about getting past survival mode, about affirming ourselves, about lifting people out of situations that prevent them from processing trauma, about forging community to empower each other, and I think most importantly about dismantling the cis heteronormative, the white supremacist, patriarchal, violent systems that inform our lived experiences and our work in helping people with trauma. I want to say that I hope this inspires everyone who listened and learned with us tonight to think about the ways we can be in community with each other. And I also want to say that to everyone watching tonight who might be contemplating their own experience of trauma, we're here for you. The center is here for you with our programming, support services, and more. And you can find out more at newhavenpridecenter.org. Thank you so much.
I also want to say thank you to all our panelists and, of course, the amazing Karleigh Webb for moderating the conversation. Also, a big thank you to the Connecticut Humanities for sponsoring this talk, and Trans Lifeline and Connecticut Women's Consortium for joining us. I also want to echo some of Miranda's closing remarks as well. the trauma we inherit, let alone the violence we experience, is again and again normalized by others as acceptable, and it's not. Being kicked out, beat up, assaulted, harassed, again, survival mode is the only way to cope with this, and it's a very hard place to escape. Working through trauma, escaping survival mode, again, same thing everyone else is saying. You cannot rely only on yourself to grow past our history. We need to understand the value of surrounding ourselves within our communities and like congregate worship of our own validity, which grows from that spark of self-worth into a blaze. So if you liked our programming, you can follow New Haven Pride Center's social media on Facebook or Instagram. Just type in New Haven Pride Center. You can follow us on Twitter at New Haven Pride. Also, though, if you subscribe to our YouTube channel, and this is particularly cool, you can watch past panels and kind of explore what we have to offer and, historically what we have been doing, and see maybe if you're interested in enjoying some more stuff. Yeah.
Elliot, that was fantastic and so beautifully said. It's really a privilege to be able to work alongside you. Finally, before we close out, if you enjoyed today's program, we'd also like you to consider joining as a member of the New Haven Pride Center. It's absolutely free at newhavenpridecenter.org/join now. Or if you can, please make a donation to support our programming at newhavenpridecenter.org/donate. Thank you all so much. As many people are saying in the comments, my soul is so filled. I learned so much, and I really hope you all have a fantastic rest of your night. Thank you.